And where's the compassion also? Where does this play out? Where does, I think, oh, there we go. So my hope is that we can define the concept of what we're talking about when we talk about resilience today and understand there's a relationship between grit and resilience. They're not the same thing. And maybe explore some of my lessons learned during the pandemic. And then how might we think about recalibrating as we go forward? I apologize, my screen doesn't seem to be advancing. There it is.
I obviously had a little bit of a challenge with that as well. It was in the lower right, left-hand
Yeah,
corner.
if you hover your mouse over,
The lower left corner is where I saw the advancing.
there might be some arrows that pop up.
Sorry, I don't see that. It should be advancing there. Well, we can go without slides. That's perfectly
You
fine.
can send it to me if you'd like. I can go ahead and get it up. I'll look at what you had sent.
Okay, if you can pull it up from your screen, that would be
Sure
great.
will.
I'll just continue here. So resilience, my definition, my working definition of what we talk about in healthcare and in life is the ability to bend, change, adapt, and withstand adversity. But being resilient doesn't mean that one doesn't experience stress and emotional upheaval or suffering. And it also doesn't mean that we're going to go back to how we once were. And I think that's an important concept when we talk about how we're going to emerge from the pandemic. When we talk about grit, we often use that again in that same context of resilience. But grit is actually much more of the force or the perseverance that keeps us moving forward. And I don't know about you, but I was trained in grit, in nursing. I was not trained in resilience. And I now teach in a medical school. Thank you. Let me just move forward one here.
Oh, you can tell me.
Oh, you can do it, Meredith.
So
Can you take it down to that one, that picture? This is a fresh-faced me, new graduate, having been trained in grit. And there's a recognition that we say resilience, but we're really talking about grit. I didn't realize the difference until I found myself a nurse on the other side of the nurse's station. Now it's close to 20 years, but with my own child with chronic illness, proceeding to over 20 inpatient admissions in less than 2 years, a chronic illness that progressed into a cancer diagnosis, which then progressed into end-of-life care. This truly changed my view of my colleagues, of observing the difference between resilience and grit, and how non-sustainable grit can be over time. So next slide, please. The popularity of grit, Angela Duckworth's research and her book, The Power and Passion of Perseverance, creates the image of the engine of grit, which is so necessary. She talks of growth mindset, which also is so necessary for that perseverance versus fixed mindset. And grit has really been prioritized in our training and our society over the idea of resilience. Next slide, please. So my analogy is grit is really like that V8 engine, that turbocharged V8 engine. Grit is the force and perseverance that keeps us moving forward. I needed that grit at the bedside, both as the professional and as the mom. I needed it to keep going. Those of us who have been involved on the front lines over the past 2 years have needed grit to keep us moving. But there's been a disconnect. And the disconnect is the sustainability. So next slide, please. Resilience is the oil or the lubrication that keeps the engine running smoothly. And we all know that engines seize without oil. And what we're seeing now, what I saw certainly in myself and colleagues at the bedside, was when we only are using grit, when that ratio of grit to resilience is in improper ratios, disengagement happens, exhaustion happens, burnout happens. And we've experienced this time of grit, all of us, these past 2 years. Now it's time to look at that balance again. And with that balance, how might we recalibrate? Next slide, please. So I'd love to learn from you, but here are a few of my lessons learned about grit and resilience and times of pandemic over the past 2 years. These are in no particular priority order, but observations that I've made about the experience and the experience in healthcare. I'm sure each of us have our own personal ones that we can share. Next slide. So change, especially in healthcare, often happens in times of crisis. I thought back, a few generations. What were some changes that happened? Well, in terms of postpartum care, maternity care, back during the Second World War, some of you may be familiar that prior to that, lying in hospitals were very common, especially in the cities around the country, the US. And basically women were in bed, lying in for a couple of weeks. Because of the shortage of nurses and staff during the Second World War, out of necessity of crisis, that changed. And women were asked to actually get up, to take a bath, take a shower, to move around. They were not in bed getting bed baths by the no nurses. This made an incredible change, actually for the better, in maternal child health. A crisis in Boston in the 1940s, a horrible fire, the Coconut Grove, caused us to really start professional blood banking in the country. Again, change happened in a time of crisis. When we think of the Renaissance followed the Dark Ages. So yes, we have been stressed and in a horrible time of crisis over the past 2 years. But what might we also learn out of this time of crisis? I think there are some innovations that may be happening and change may be happening. Next slide, please. One of the things that has certainly become evident with our isolation, with our social distancing, both health and illness are social. This has become so evident. These are not individual entities. We know that the social determinants of health are playing a huge role in ways that we only talked about before. Now we're visualizing it. We're seeing it every day. Next slide. I mentioned this before. Grit is not sustainable long-term without resilience. We are seeing the effects of that, of course, with staff leaving, higher rates of suicide, mental health issues because grit has been used successfully, but not sustainably. Resilience has not been prioritized in our system, but grit has. Next slide. I think this is a slide that maybe we can discuss a little in the second half. We all go into healthcare, or most of us, with a high level of empathy. But interestingly, studies have shown, and anecdotally we know, that empathy without compassion is actually very draining. So compassion is the action arm of empathy. Compassion is something that we can do. So it's important to think about your empathy and then how may I act upon that empathy with compassion? So compassion is the action arm of empathy. But if we only are sitting with the suffering and the empathy without compassion, we are going to be drained. Next slide. I don't know if any of you are as old as I am and remember MacGyver from back in the 1980s and 90s. Angus MacGyver was the original hacker. And for those who don't know, MacGyver was somebody who elegantly would find solutions using existing resources to very complex problems. We all have MacGyvers in our organization, and we are MacGyvers. He could take a paper clip and do anything with it. I will bet you there are many, many MacGyvers within your organization who you don't even know about that are waiting to be asked to figure out an elegant solution to a problem. So seek out the MacGyvers. And during this pandemic, I have seen so many MacGyvers come out of the woodwork. It's wonderful to see that. Next slide. Innovation happens at the bedside, not in the boardroom. I can't emphasize this enough. I don't know if any of you saw this picture on Twitter last year. 2 nurses in Brazil came up with this idea when there were no visitors and patients were totally isolated in ICUs, in COVID ICUs. And what they did was they took warm, hot water into 2 surgical gloves, tied them together, and placed them in patients' hands. Such a simple but profound innovation that went worldwide. It went global. We saw it happening in other venues. But it happened at the bedside, not in the boardroom, not in Silicon Valley. Next slide, please. We've heard a lot about elders and the loneliness and the disconnection that COVID-19 really exemplified and spotlighted on the isolation. We also have to look at the kids, and all of us are in pediatric realm. How much this loneliness, how much this isolation has disconnected and has hurt. We haven't really tracked illnesses. We were looking at mental health, of course. With elders, we have actually seen some morbidity and mortality rates that are associated with that isolation and loneliness. But the good news is that ways of connection can heal. And so perhaps we're going to become more creative, or we can think outside the box with how important connection means. That loneliness does hurt and connection does heal. And hopefully we will take from this pandemic those lessons of how important connection is for all ages. Next slide, please. Some interesting research has been done on gratitude and happiness. And one of the findings is that being grateful, gratitude leads to happiness, not the reverse. So happiness doesn't necessarily lead to being grateful or gratitude. It shines a light on the necessity for actually lowering the bar on what we might be grateful for. It gives purpose to perhaps those small things that we can do to help our own resilience, but not necessarily starting with happiness, but starting with gratitude. Next slide. When I often talk to healthcare groups or individuals in healthcare, I often hear, I just want everything to be balanced. And meaning like Lady Justice with the scales of justice. Forget about it. It's never going to happen that way. Think of balance as a gyroscope. So you know those gyroscopes you can play with on your desk, and they kind of wobble, but they right themselves. And they always look like they're going to tip, but somehow they find their way back. I like that image as a much more realistic image. Balance is never static. It moves, it changes. That's what we're seeing now as we are reemerging, and also during the time of the pandemic. Next slide. I think this is really important. We want to go back to the status quo, but it's no longer working, and we can't return to healthcare as it was. We have been changed. Our patients have been changed. We are not going to return to exactly the way that we left it 2 years ago. And if we try to do that, then we are going to meet with frustration, disenchantment with our jobs and the healthcare system as a whole. It really is time for a recalibration. This gives us an opportunity to think what's going right and what isn't or hadn't gone so right. It wasn't that great to begin with. So what might we change? One of the things that comes to mind with some work that I did with Massachusetts Health Quality Partners is a survey that was sent out to pediatricians, internal medicine practices on telehealth. And as you all know, we were thrown into telehealth. We've been talking about it for a decade, but the pandemic threw us into action and creating in a very short time telehealth. We did a survey on patients' satisfaction and clinicians' satisfaction. What was fascinating, patient satisfaction was extremely high with telehealth. Physician and other practitioner satisfaction was less than 40%. There's a huge divide there. What were some of the things that the patients loved? It was my doctor's on time. I had easy access. I didn't need to pay $20 to park. I didn't need to take time off of work. I felt I was being listened to individually. What didn't clinicians like? They felt they were on their own. They weren't trained for this. There were too many technical things that could go wrong. Those are all things that we can solve. Those are all things that we need to address. It's time to look at what has come out of the pandemic as necessity and say, do we want to work with this and recalibrate? What are the things that worked, what didn't? Next slide. So to get to the end here, so we have plenty of time to talk, I'm going to offer a few 5 simple strategies for recalibration that we begin with ourselves. Don't try to change the world immediately. Start with yourself and start small. Maybe one thing a day. Adjust your ratio of grit to resilience. Think of it. Are you using too much grit? Is there any resilience in there? Do you need to top off the oil in your tank? I practice mindfulness. you may have some other self-care strategies that are really important to you. Dust them off, put them into a daily practice. They don't need to be long. Mindfulness isn't airy-fairy. It's simply paying attention to the present moment while you're living it, even for a very short time. We have a lot of data that suggests that that can lead to gratitude, lead to more focus and less stress overall. Examine, assess, and reset often your level of recalibration. This isn't a one-off. This is something that we need to keep working on time and time again. And here's your Wordle of the day. Actually, it isn't 5 letters, so sorry. Sagacity. Use your sagacity, which means your overall wisdom, experience, perception in new ways. I'll give you an example of what mine has been. A number of years ago, I followed a blogger. Her name was Lisa Adams. She had stage 4 breast cancer and wrote about living with the changes of being a mom and having cancer. And she put out this mantra that I use to this day. Lisa passed away probably 10 or 15 years ago now. And it's my sagacity that I find very helpful. Find a bit of beauty in the world today. If you can't find it, create it. Some days it may be hard to do. Persevere. And I would say one thing beyond what Lisa said, lower the bar on what's beautiful. You'll find it in some way. It might be ironic, but there is something there every single day. Next slide, please. So that was a great car at one point. Too much grit, not enough resilience. Next slide. Perhaps this is our goal. Grit, the right amount of resilience and a recalibration, inner strength, you're good to go. Next slide. This is my contact. Please connect with me. I would love to answer any questions you might have or expand upon any of these ideas. And I'd love to hear your lessons learned. We need to share how we have been changed by this time of trial, this time of learning. So with that, I'd love to turn it over to Paula and Bill, and thank you again for giving me this opportunity to share some of my thoughts today.
Pam, thank you very much. That was wonderful. The imagery was really clever. I think Bill and I are just here to help moderate. And I don't know if anyone has a burning question at the moment. I do have one.
And it'd be great for everybody to turn their cameras on. So
Yeah,
we can see each
it's
other.
not that big of a group. So we can make it more a discussion. That'd be great. Oh, there's some people.
Yay! They're not black boxes.
Yeah.
Hi, everyone.
So if no one else has a burning question, I have one that I just thought of while you were doing this. And, you know, when you talked about grit, it seemed like it was that mantra that was in the UK during the Second World War, you know, keep calm, carry on. So if that's grit, and that's what we've done through the pandemic, just keep going, just don't look back, whatever. What would resilience have looked like? So I can know how to balance and make a ratio.
Know if that was all grit, Paula. So I think it was also a clever tagline that connected people to a shared mission. So I don't think that's all bad. And I don't want to leave the impression that grit is all bad. So I think that how resilience looks is there is a small reflective process that resilience hooks in to that grit. You have to have grit to do our job. You have to have grit to do our job. You
feel
can't do
like
it by that just being oil, right? I mean,
Yeah.
yeah, okay, that's not going to work. But I think, when we look at, I come from the nursing background. When we look at physicians, nurses, social workers, child life, where people are getting disengaged, where they're feeling totally wiped out is when there is no chance to reflect upon the suffering that they have seen and witnessed and experienced themselves. And they don't have a place to put in action with it. Okay. And that's that compassion piece that
Yeah.
I mentioned. What can they do with that? I think that's the difference.
Okay.
So maybe to your example, during the UK, the people who designed that, who got all the posters up and everything, actually, that was rather a resilient thing because they were working with an action out of this. Does that make sense? So I think this, asking people to do triple shifts or, blah, blah, blah. And that is non-sustainable. I spoke of my own experience of being trained in grit and then being thrown into the unimaginable of being a parent, which I had been on the professional side for many years and had no clue on the exhaustion and the non-sustainability on the parent side. And when you have over 20 admissions in less than 2 years and you're in an ICU and you're home and you have other kids, and we're asking those parents to be sustained on grit as well. And when we don't honor and say, I know you're exhausted, you're doing a great job. What are some things that help you or that you can feel you can take a breath? For me, I pulled out a notebook. I write haiku, and I have written haiku since my son was sick, and I had a daily practice. And finding that little bit of beauty, I still do it. It's so small,
Okay.
but it was a reflective practice in the midst of grit.
Okay, that's helpful. Thank you.
So can I, because I've tried to figure out, what is resilience and what it seems to me, obviously, they're not mutually exclusive. You can have grit without resilience, and you can have resilience and never have had grit. And it almost seems to me that grit is a state and resilience is a trait, meaning you have if you're a resilient person, in retrospect, you get through something and you come out the other side and you've been resilient. And so grit is something to me that happens in the moment. I guess resilience did too, but resilience is it's a longitudinal, I guess, experience in some ways. I don't exactly know how to say that. And
Yeah, I hear what you're saying, Bill, although I think that resilience can be built, and it's a skill that we can build. For some people, it's easier to be more resilient. I think anybody in healthcare has grit.
Right.
Anybody who's working in healthcare, you can't have been in healthcare without grit, because you wouldn't have been able to do the hours and do the stuff that goes with healthcare. So I don't think there are too many people in healthcare who are only resilient without grit. I think that you are right that state and trait and building on that. I think we often don't recognize grit at the time. We recognize it perhaps as we go farther. I think the other thing we don't recognize is when we have overused grit to the point that it's not working that great anymore.
And I'm so much more obviously, I'm more interested in how you build, as you mentioned, resilience rather than grit. And how do you, one of the things I say now about myself is lived a fairly long time. I look back and there's been times when I've had to have grit. But now it's like, well, how do I I'll make it through this because I've made it through other things like this.
Yeah.
That's resilience. So is resilience something you build on, you have experience and then you build resilience, but how do you infer resilience on other people? Because that's obviously what we should be, to my mind, be doing right now. How do we make
other people more resilient?
Right.
I think those of us who have been successful, and I think that goes back to, I think all of us come into this with some, as I said, the word sagacity, which really means experienced wisdom, perception, etc. Something that's worked for us before that we take into the present moment. And to build upon that, I don't see a lot of mentorship around this to our younger colleagues. I see a lot more of, hey, I sucked this up, so can you. I worked these hours, it actually was a lot harder when I blah, blah, blah. I see that more than saying we are in unprecedented times. How might we work together using some of my experience and your experience to innovate on what would make this more sustainable for all of us? I think we have an opportunity here to learn from each other. And I don't think it's exclusive that we can teach this. I think it's a shared design function for all
So
of us.
Cynthia, it looks like you have your hands up.
I was going to say Cynthia Laporte.
Hello, everybody. I'm from Loyola in Maywood, Illinois. So thank you for doing this. Appreciate it. I struggle with the Kubler-Ross moral and confidence and timeline, the change, the shock, the denial, the frustration, the depression, experiment, decision, and integration. And that's where I see the next column should be innovation. We have, if you've been in the career of nursing a while, what we have is we have outside forces directing nursing care, demanding us to go into certain situations and not letting others go into situations, such as our child life team. Protections are in place. We've never been in such a opaque space of understanding where the truth is. We're science by background. We understand the science, but I think I've never in my career heard one day it's this science and then 30 seconds later it's another science and it's okay to do the third science. That is a confusing space to be in. And so I think that having these groups of processing and reflection and journaling and conversation is so helpful. We're very visual too. And so to have our masks on, which I of course have, right here, and the shield and all the other crusader wear that we're wearing for protections, it's one thing when you have the identified organism that you're looking for, the bacteria, what you're looking at. The invisibleness of all of this has struck us all emotionally crippled. And the importance of the grit, because I love that book. I love it. It's a great read.
It is.
And it is who we are, and it is how we push through, and it is the domain which nursing and all of our colleagues, our interprofessional groups have. It's just the endurance of that for us to maintain the nutrition of our mental capacity to be able to care for ourselves and our patients and our families with all of the complexities that are going on. We have never traveled in this adventure before, never. And I think that we need to verbalize it more, or we need to do artwork from it, or we need to write music about it, or do the poetry about it. When you mentioned about the Renaissance, that's what nursing needs to bring through, that art of the complexity, and to be able to care for ourselves holistically. It would be great to look at the research, how many nurses have not been physically affected by this this invisible virus, and what did they do? What was their story? How did they bring their teams along during this time? What an incredible thing to be part of right now. It may not be called a world war, but it certainly is in my world. This is absolutely incredible. I've
I-
never told a family not to come before, to come and visit their child. How do you do that? They have put us in restrictions that I never thought we would have. Very
I think you
terrible.
say such important pieces, Cynthia. I would love to see us as a collective, perhaps, Neil doesn't know I'm going to say this, but child kind shepherding a conversation and come out of it with how might we go forth with innovations, nursing, child life, physicians, and actually give the thoughts from these child kind hospitals. I think one of the things that this is different is this is not a natural disaster that had a beginning and an end, right? And that's what we've been trained for also, are things that have a set endpoint. And the rules have changed as we have gone through this. And I think that's what makes it even more confusing and difficult to process, because you can push through a lot when you know there's an endpoint there. And I believe very strongly that we can't go back to our status quo. We have been changed, and we have been changed personally and professionally. And if we try to put ourselves back in those same pegs, it's not going to be a fit anymore. So how do we process this and go forward? I see Beth, one of my former students, has her hand up there. Beth, can you join in? Unmute yourself.
Can you hear me okay, Pam?
Can Beth, hi.
Thank you. I'm sorry I'm not on video, but thank you so much for being here today. And I think this is very timely. And I certainly think that many of us can relate to the struggles of this pandemic, both personally and professionally. And I am actually flying out to Dallas to go to a funeral this weekend, and I'm staring at a book I ordered called Resilient Grieving by Lucy Hone. And I'm probably far behind, and you all have read this, but just trying to find an alternative, I think, to the 5 stages, the model of grief. And I'm really looking for tools that, I think your podcast you had mentioned is one great way, but tools to help encourage our colleagues and also our families. My role is working with pediatric palliative care, this idea of feeling isolated and alone, and how do we celebrate someone's life and how do we acknowledge that, but how do we also find ways to grieve the trauma of a loss that changes everything, but also somehow continue to live. So I don't know if you can speak to either the book, or if there are, in addition to your lessons, but kind of some tools that I could share both professionally and personally as we continue to forward.
I see a book that needs to be written here. Or maybe it's not a book. I see some podcasts that need to be done. I see some new writing that needs to happen, Beth, because, well, you've heard me talk about this before, but fortunately in our country, number one, pediatric death is not that common. We are not exposed to it as we used to be. People don't quite know what to do with it. End of life care in pediatrics is very fragmented, and everyone has, there really hasn't been a lot written in this way that you're talking about. I think with the pandemic, even though we didn't see huge pediatric deaths, what we were exposed to is incredible illness in a society, and death that wasn't expected in societies. And I think from a pediatric lens, we could pull that experience and the experiences of those nurses and physicians and child life and social work and on that experience of the isolation, of the unexpected death, of this grief. I agree with you. There is no linear trajectory for this. I think there's a book to be written here. I think there are lots of conversations to come out of this. As for resources, Beth, I don't have any at the top of my head for you. Maybe somebody else does, but I'll certainly see what I can come up with and put them up. I'll send them off to Meredith and she can share them. But I think we need some new stuff. Thanks for your question.
Gary, do you have some comment or question?
Sorry, I was trying to unmute. So Pam, I appreciate your views and what you had to say. And clearly your focus is on the individual, that individual people bring grit, individual people are resilient. And I think there's a very important other piece of the equation that needs to be addressed, which is you can give me the most resilient person in the world who has the most grit of anybody you've ever met, and I could put them in situations and circumstances where they will break. That whatever grit they have, whatever resilience they have, I can still overwhelm them. And what's happened in our society over the past few years is that we in healthcare have been asked, based on essentially our altruism to caring for our fellow human beings, to be put in relatively crazy situations, like to be asked to go in and take care of people who have an extremely communicable and deadly disease and not give people adequate protection is insane. Or to say, I know you've already worked a full shift, but we're short and we need you to work more hours. Or, you used to provide clinical service this way, now you're going to provide it that way. And I dare say that many of the leaders in our organizations fail to appreciate the notion that we're not the only ones who need to cope and adjust. Perhaps the system and the expectations of the system and maybe even society need to change. I don't think we can continue the way we've been with the expectations that healthcare providers are going to just keep bouncing back over and over, even to the point now that, the time that you're out if you get COVID is being reduced, that you can barely recover before the expectation is you're back. So I think a lot of the discussion also needs to focus on that end of things and not just our resilience and our grit.
I wholeheartedly agree with you, Gary, and thank you for bringing that piece into it. I didn't mean to exclude our organizations or our society. I think it needs to begin with ourselves to then affect change within an organization and a society. So an organization or a society is made up of individuals. And as we band together with, we're not going to do this like this, or this is not the way we're going to recalibrate or go forward or not recalibrate. I think our voices need to be heard, but it needs to start with each of us believing that we can make change. I do believe very strongly that we need to see a major shift in healthcare. And this has shown a spotlight on that. You're absolutely right. It's crazy. It is deplorable what our frontline workers have been asked to do. And how might we work together for change? I don't have the answer to that, but I believe there are the two facets. There's the individual, and how does the individual work collectively to affect change in a group? I think that's a possibility, but I am open. My ears are open. I love this discussion, and I love, I love us to move forward and not actually just sit in the status quo. So I hope we can find some ways to keep thinking about this in different ways. Other questions?
Anyone else? Any comments? Any ways that you're helping your own place develop resilience? Oh, come on.
Bill, it's not helping my own place to do it, but I do think one of the groups that have had the most difficult time are young women who are trying to balance jobs, expectations of employers, family responsibilities, children, homeschooling, all of this. And having two daughters in that situation, they remind me constantly how much compassion means, especially coming from their boss. And so I think things like trying to be supportive to them, adjusting work hours, being accepting of kids in the background, noise in the background, rescheduling meetings. I tell them I don't have to have all these responsibilities. So you tell me when it's a good time for us to meet. And it's surprising what they'll say. Often it's like 8 o'clock at night after the kids have gone to bed or whatever. So I do think, Pam, you mentioned mentorship. And I think that is something that we could do a lot better job at, and maybe we need to focus on training mentors as well.
Absolutely. Good point, Bonnie. Good point.
Thanks, Bonnie. Anyone else? All right, well, we can end a few minutes early. Paula, do you want to wrap us up?
Sure. I mean, I think it's been a great discussion. I mean, and I think one of the things that comes to mind for me is not only how do we survive as clinicians and researchers and people that want to move a different agenda forward too, right? Like we're a pediatric pain community. And so when you're trying to bring about change and improve pain care with the big COVID here, and people are focused there, I always think that, I worry that will we be feeling that we only have grit and without any resilience, so that we can keep moving and advocating and improving pain care for kids in this world we're living in at the moment. So I think, if you have any parting words, I don't know, Pam, if you have any parting words on helping us to I guess just continue to work together so that we are able to, and continue to keep resilient and move pain care forward, even though we've got to deal with all this COVID stuff as well.
Well, I'll go into one of my lessons learned, and I'll shift it from the patient to our community. And isolation and loneliness does hurt, doesn't it? I felt very disconnected, and it's been hard. And connection heals. And how can we, as our community of Childkind, truly become models of this connection, of resilience, of mentorship, perhaps, of innovation? That's an opportunity we have. And I think I would also end with, find whatever your sagacity is, your wisdom, your experience, and share that in some way. That's a first step of recalibrating. We all have that. What might yours be? And how might that be your step from empathy into the compassion, into the action arm of empathy, of compassion? So sharing that is an act of compassion. So that's how I would end. Start small. You don't need to change the world today, but it's nice to take one little step. And I really appreciate everyone's suggestion. I would love for you guys to send some of your lessons learned on to Meredith or myself, and perhaps we can share them in a newsletter or the Child Kind website. I think, as we learn together, that's going to be the most powerful for recalibration. So thank you.
Well, thank you, Pam. This has been a really enjoyable hour, and I've learned a lot. And I think it's been a great discussion. It's been wonderful to see everybody engaged, and I appreciate everyone being here and being engaged. And I think that last note in terms of sharing and mentoring, that's what this whole community of practice is for. So I guess it really resonates with the action items to keep us resilient. So I thank everyone for coming. I look forward to seeing you on our next webinar, to be announced, but it's in the thought process. And if you have any ideas of what you think would be helpful around one of these community practice and improving pain care and or just how we do things to keep our eye on the ball and keep moving, please send them to Meredith. She'll share them with Bill and I, and we'd be most happy to look at having something of your choice. So again, thank you, Pam. And Meredith, as always, without you, you're the glue to keep us together. Thank you. And I look forward to seeing you all. And as always, Bill, a pleasure working with you.
You too.
Bye.
Everyone.
Thank you.
There.